Causative factor are below. Causative factors of mental illness. A biological B. Psychosocial C. Sociocultural. Factors. 1. Heredity 1. Maternal 1. War and organic causes deprivation violence. Physical defects 2. Pathogenic 2. Economic. Physical family pattern problems deprivation 3. Pathogenic 3. Technological 5. Emotional factors interpersonal change. 6. Surgical relationships 4. Social change operations 4. Profound stress 5. Occupational. 5. Mental conflicts difficulties A. Biological factors. Heredity. Heredity is often regarded as a causative factor. About 3/4 of mental defectives and 1/3 of psychotic individuals owe their condition mainly to unfavorable heredity. What one inherits is not the illness, but predisposition to develop the illness. This predisposition determined by genes which we inherit directly. This predisposition determines an individual's susceptibility to mental illness. Organic causes. The principal organic causes that can predispose to mental illness are loss of brain tissue due to trauma, local injuries or generalized brain disease. Damage to brain tissue by toxins such as alcohol, drugs, chemicals, heavy metals, etc. Interference with brain tissue by changes in blood chemistry such as disturbances of blood sugar level, disturbance of acid-alkali ratio, insufficiency of oxygen, disturbance of fluid and electrolyte balance. Endocrine and metabolic disturbances may lead to changes in general efficiency of bodily functioning with resulting feelings of frustration or insecurity. Physical defects. Physical defects include all physical anomalies or disturbances such as blindness, deafness, lameness, clubbed feet, cleft lip, cleft palate, etc. These defects generally tend to create a sense of inability to meet the social situation and lead to feelings of inferiority and insecurity. These in turn may cause undesirable psychological reactions of a compensatory, aggressive or other defensive. All NJI leanness. Nature. Acute physical illnesses may lead to acute brain syndrome, which may result in loss of mental capacities. Chronic illness produces frustrations and stress, which in turn may cause neurosis. Physical deprivation. Physical deprivations include malnutrition, vitamin deficiencies, sleep deprivation, fatigue, etc. Severe malnutrition, vitamin deficiencies, sleep deprivation, fatigue, etc. Severe deficiencies of vitamin B complex are a very vital causative factor in mental illness. Pellagra with ATL. Its psychiatric symptoms is a deficiency reaction rising from deficiency of nicotinic acid. Sleep deprivation and fatigue over a long period of time may cause mental disorders. Fatigue which is produced by persistent anxiety or by boredom may indirectly cause mental illness. Fatigue may at times weaken the controlling strength of ego. Emotional factors. Emotional factors also cause many of the mental disorders such as psychosomatic and disorders, e.g. hypertension, peptic ulcer, coronary heart disease, asthma. Many times the anxious behavior of a mother is passed on to the child. Surgical operations. Surgical operations in certain regions of the body or amputation of one part of the body may result in few psychiatric disturbances as mild delirium or psychoneurosis. B. Psychosocial factors. Maternal deprivation. Maternal deprivation means the child is deprived of maternal stimulation of mothering. Separation of the child from the mother is bound to affect his growth. Lack of maternal love, warmth, security and support affects the emotional and social growth of his personality. This deprivation of maternal affection and stimulation becomes a predisposing factor for abnormal behavior at a late stage. Pathogenic family pattern, strained or faulty parent-child relationship also affects the behavior of the child. The treatment of parents with the child may be unduly harsh and repressive. Discipline may be of negative type. All this leads to frustrations, insecurity, low self-esteem and negativism, and this on time may develop into mental illness. Overprotective parents may overindulge their children so much that they become tired and dependent and thus unable to fight the battles of life well. Pathogenic interpersonal relationship, strained or pathogenic interpersonal relationship at home, place of work, school, college, etc. leads to emotional instability. All these situations may evoke ESSENT ALS of psych Arni Roa nurses emotions which are unpleasant and unacceptable. If these continue may lead to neurosis, psychotic or psychosomatic illness. Profound stress. Stress is also cause of abnormal behavior. Stress can be classified as physical stress, physiological stress and emotional stress. Physical stress may be due to starvation, earthquakes, floods, cyclones, fire, house collapse, migration, slums, pollution, etc. Physiological stress may be due to puberty, pregnancy, childbirth, lactation, fever, systemic diseases, etc. Psychological stress may be due to strained interpersonal relationship, family disharmony, marital disharmony, sexual maladjustments, death of a family member, occupational difficulties, financial difficulties, failure in studies, failure in job, educational problems, etc. Mental conflict. The most vital psychogenic factors in the causation of mental illness is the problem of mental conflicts and consequent repressions. Conflicts may be between the individual's instinctive desires, motives, impulses, strivings and his ideals and higher sentiments. These conflicts cause unpleasant emotional attitudes, repressions and formation of complexes. See socio-cultural factors. 1. War and violence. War and violence due to various reasons leave an impact on mental health of people. War and violence lead to physical stress and psychological stress that may lead to mental illness. 2. Economic problems. Economic or financial problems due to poverty, affluence, unemployment. Accompanying vices like gambling, alcoholism, prostitution, etc. is another contributing factor to mental illness. Sometimes economic problems lead to suicide and even homicide. 3. Technological change. Rapid technological change is causing too much stress. This increases frustration and conflicts and may precipitate mental diseases. Social change. Social changes such as changes in religious and cultural traditions, social crisis, social deprivations, recreational deprivation, migration, loneliness, generation gap resulting in boredom, isolation, withdrawal, contribute to development of mental illness. Occupational difficulties. Occupational difficulties due to unhappy working conditions, strained relationship with superiors or colleagues, shift system, lack of PB-SAT, stackuon, intermittent employment, temporary employment, unemployment, etc. cause psychological stress that may be precipitating factor in the development of mental illness.